Welcome to our panel discussion, Driving Growth and Retention Through Uncertainty. My name is Dave Bush. I'm a strategy consultant who has done work for Benefitfocus, but have also been a health plan customer. The COVID-19 pandemic upended businesses and healthcare systems across the world at alarming speed. Healthcare companies are at this epicenter of the impact, the management, and the response. Payers are working at overdrive to do the right thing for their employees, customers, communities, brokers, and members while trying to adapt their operations to a rapidly changing landscape. We're very excited today to have three exceptional professionals providing their unique perspectives on what is not really a new normal, but a series of interim normals, representing the health plan perspective, the broker perspective, and the benefit manager for a very large company. It's my pleasure to allow them to introduce themselves. We'll start with Gina.
Hi, everyone. I'm Gina Laird, and I am the Senior Vice President over Benefit Operations at Blue Cross and Blue Shield of Louisiana. I'm a native of Louisiana, having been Blue for over 28 years. And we're somewhat accustomed to, disasters and pandemics. In fact, we're recovering from the most recent hurricane, Hurricane Laura, for those of you that haven't been watching the news. But we're used to this, but this pandemic has really been something else for us. I have responsibility for the Benefit Operations Division, which basically consists of enrollment and billing, our claims operations, our customer service operations, as well as the team that also supports the configuration and maintenance of our core platform. So as you can imagine, tremendous responsibilities and trying to ensure that through this pandemic that we take care of our most important asset, and that is our members. So I'm happy to be here today.
Great, thank you and welcome here. I'd like to move over to Tricia.
Great. Hi, Dave, and thanks to Benefitfocus. This is such a great opportunity to talk with you all. I'm Tricia Hemsky. I'm the Employee Benefits Practice Leader for our Colorado region, which means from a consulting standpoint, we really try and identify what is new and next out in the environment and bring those to our clients. So we help all of the companies identify what their benefits are, from health benefits to 401k, and make sure that they stay compliant with all the rules and regulations. I've been with Hub for about 5 years, but I've had about 15 years in the employee benefits arena. Started my career in banking and IT, so I've been around a little bit, and I'm really looking forward to our conversation today, so thanks again.
Thanks, Tricia. Thanks for being with us. And last but not least, Sandy.
Thanks, Dave. Hi, everyone. I'm Sandy Stein. I am the Global Head of Benefits for Brown Brothers Harriman. Often we are confused with maybe a real estate company or a law firm. We're actually celebrating our 202nd anniversary as a multinational bank. I sit in New York, and you can see New York behind me. I'm responsible for our global benefit programs as well as our global mobility program. And indeed, this is a very, very unique time, and thanks to Benefitfocus for posting and putting a spotlight on what's happening within the world that we work.
Great, thanks, Sandy. Well, thank you all for being here. Let's get started. The COVID-19 pandemic has had a broad impact, and I'd like each of you to talk a little bit about how it's impacted you and your organizations, both in the near term, but also what are the things that you're looking down the road as potential impacts in the future. Gina, let's start with you.
Okay, great. So I guess the things that we had to deal with in the near term are, the first thing was to quickly transition our workforce to working remotely. We had to provision equipment and we had to get everybody working remotely. And, I'm very proud to say that our organization did that in record time. I think we had everybody up and running within like 7 days, and we're talking over 2,400 employees. Before the pandemic, we probably had about maybe roughly 30% of the overall employee base working remotely. And now we're at 95%. So we've done a lot to, get everybody situated, settled, and productive as quickly as possible. We've also had to look at switching technology out so that we could, have better collaboration and communication through remote technology. So, it's been an adventure. It's been kind of a roller coaster. Most of the employees that were not working from home were actually not working from home because they were afraid to work from home. They didn't think that they could be productive. They wanted to come in the office. And I think one of the things that we're finding through this process is that surprisingly, people are very excited about the fact that they are working from home now. There's a lot of silver lining in that. They're not having to commute. They're able to spend more time with their families. So those are some of the great things that have come out of this process. And we've learned that, we have really had no impact to our productivity and all of our processes. So near term, those were the main issues that we've dealt with. Obviously, our first priority is to take care of our customers. So, right after the pandemic and everything, we had a lot of emergency rules that we had to rush to implement. We changed a lot of our policies and programs to give people access to medications, to give people grace periods on premium payments, to offer alternative products to employees that were terminated by their group customers. We saw a tremendous increase in telehealth access, which benefited both, the patients and the providers. So we also, as a company too, we wanted to really take care of our customers. And so we opted to have no cost share for anybody that had testing and treatment for COVID. And we're still doing that. So, these were some of the things that we quickly had to adapt to. And it really, the employees of the company and the leadership of our organization really demonstrated tremendous flexibility and adaptability through this process. Longer term, of course, we're looking at things like financial solvency. We're watching our claims very closely because we are waiving all cost share for anybody for the treatment and testing of COVID. So we're trying to, just watch that. We're also looking very closely at our administrative expenses, trying to, optimize wherever possible, because we are seeing, we kind of have a bit of a double whammy in Louisiana, because we've got the effects of the pandemic, but we also have the effects of the oil industry. And so, we have a lot of oil and gas companies that are our members, and so they're feeling the effects of, the suppressed oil and gas industry right now. So we're not really losing groups, which is great news. All of our groups have stayed with us. In fact, we actually have a net gain of groups so far this year, but the groups are shrinking. The employers are, having to lay off as a result of the economy and everything. So we are seeing attrition through our membership base. So we're trying to watch that very carefully, and deal with that for the future. We also are challenged with, as we try to tighten our belts and tighten our administrative expenses, we have a lot of strategic initiatives that we are, still believe are very important to do. So the challenge long-term is going to be how to balance that and how to ensure that we find a way to fund our strategic initiatives. And so we're doing that through really examining our processes and trying to optimize, things as much as possible.
Great, thanks, Gina. Tricia, you want to go next?
Sure. I think of things in a couple of different ways. One is how we are dealing with our partners, and the other is really how we're helping clients. So I'll talk a little bit about both. In the near term, we're spending a lot of time with our partners that are the Blue Cross Blue Shields of Louisiana, and trying to make sure that we understand how they're dealing with the claims costs. So as our clients are figuring out how they're going to, what they're going to expect for their renewals next year, we're staying really close to understand the financial side of things from a claims perspective, but we're also spending time in the longer term looking at the products. Gina really mentioned telehealth, and mental health is a challenge in everything that we're reading about with how we're seeing the impact of COVID hit our population. And telehealth has been a real guiding light for a lot of folks to figure out how they're going to be able to reach out and get past that stigma. So trying to marry those right solutions, whether that's telehealth or trying to figure out what narrow networks are going to really appeal to people. We've been able to figure out how to fast track a little bit some of the strategies that our companies have maybe been a little reticent to move on. And maybe that's seen in open enrollment through a lot of technology or some of those pieces. In the near term with our clients, we've spent a lot of time on webinars, like I'm sure everybody on the panel and out there that we're talking to has spent tons of time sitting in front of a screen, but trying to really get actionable information out to folks to help them feel a little bit more connected, to help them understand exactly how you would go back to work, if you're able to go back to work, how you would do that in an elegant way, make people feel protected and safe. And finally, I think the thing that is on everybody's mind is how can you give people a little bit of grace? I mean, we've all moved back, we've moved into a virtual environment. We're sitting in our houses, spending inordinate amounts of time with our families, which, for some of us is a good thing, but even if it's a good thing, it can be a little bit distracting. So being able to give folks a little bit of room to be human, I think is really the impact that I'm seeing. We've talked a lot about work-life integration in the past, and I think we've given a little lip service, but wow, are we integrated now? So it's pretty exciting to see where this could take us. And sometimes I can't wait to get out to even have a mask on and eat lunch with somebody who I don't live with.
That's a great point, Tricia. It seems like telehealth has been the coming thing for so long, and now it's really moved forward. Telehealth and teleconferences and telemeetings like this seems to be kind of the go-to things in a lot of places. And I'm definitely hearing a lot more dogs barking on meetings. Sandy, you want to
Right. Kids walking behind, sure.
Yeah, a lot of that. Sandy?
Sure. So similar to Tricia, I'm thinking about this from two perspectives. In the role that I have, we are about 6,000 employees worldwide in 9 countries. And what comes to mind for me is spinning plates. So I think about this from the employee perspective, but I'm also thinking about it wearing my employer hat. And I've got a laundry list of things that is probably no different than my peers, who I have been fortunate enough to stay very connected with, understanding what other employers are doing to adapt. So when we think about the employee impact, naturally engagement, performance is really an issue that HR and senior leadership are thinking about. But then I think about some more operational areas such as virtual. We are a high touch culture, and we meet in person a lot, and that's something to think about for us on a longer term basis. But we were not a technology company savvy with respect to leveraging virtual tools. I would have to say that we have responded incredibly well as an organization. Some of the more tactical things that we've had to do would be to implement and stand up a resource library on our HR portal, and we would have to do that times 9. So that content has to be very much customized depending on where you sit in the world. In the US, as an example, looking at the CARES Act and understanding what of that legislation makes sense for our population. And that was not necessarily an easy task. There were things that we had to do, and there are things that we didn't have to do. So that's really where we got a lot of attention and focus. Naturally, there's costs associated with some of that. As part of my remit is also global leave administration. And as everyone can imagine, and those prior to me spoke about, we had to look at policies and understand legally what we needed to put in place. We worked closely with our carriers in making revisions, looking at our policies, but also making those policies transparent when pre-COVID, that was not anything people were familiar with. Mental health is a big, big deal. And the one piece I do want to mention about mental health in particular, I'm really pleased to say, and the timing could not be more fortuitous for Brown Brothers, is we engaged a new EAP provider in January. And boy, there's no way we could have planned better for that. The resources, and this is a vendor that has a lot of technology enabled solutions, which we couldn't have planned any better. Well-being, I'm gonna tout that we, in the midst of a pandemic, we were the recipient of well-being best employer to work for, and there's a lot of resources on our platform that we were able to leverage really successfully on a global basis. Childcare, big deal. I don't have to say that more than once. Everybody knows that. But one of the other pieces from the employee perspective is we've experienced employee deaths. How to message that, how to communicate that. And just a couple of not small items, but on the employer perspective, looking at our claims. What would be the impact to our claims costs for 2020? And earlier today, looking at planning, budgeting for 2021, and some decisions we'll need to make around how to budget for 2021. Recognizing that the elective types of services dropped significantly, dental dropped significantly, but we've got other things to consider with respect to budgeting. So whole lot of stuff. The one other point to come back to on mental health, and specifically point solutions, digital solutions, we talk about mental health challenges, needs, etc. However, Brown Brothers did not experience a real big uptake in utilization in our EAP. And based on conversations I'm having with other colleagues, others are experiencing the same. So I think that's something we need to think about. And I can share some things we're thinking about longer term as we get deeper in. So thanks, Dave.
No, that's really
Dave, if I could just jump in.
Absolutely, please.
I just wanted to add something long-term that I think is really, really important, and it's been coming up with me lately. I think we all spend a lot of time as leaders communicating with our teams, and you feel like you've done a really good job in the past. But being in a remote work environment, really you have to much more intentionally create a structure around making sure you're touching base with everybody that's on your team. Communication is something that we've really had to ramp up. And I think that's a great message for everyone to think through. What are the ways that you can use, I mean, not just reaching out and having a virtual happy hour, but really some of the things that you thought you could say once and would resonate, you have to say again and again and again. We've been talking about that for a long time, but I would say a virtual atmosphere really just dials that up even to the next degree.
Yeah, that's a great point, Tricia. It's funny, we talk about the loss of the hallway conversation and how do we replace that.
Exactly.
And replace the time before the meeting and after the meeting. Gina, I want to come back to something you said, because you referenced remote work and how we interact with each other and strategic initiatives. And I was talking to a friend, and he was saying, if we made a strategic initiative to take everybody remote work, it would have been a 2-year project. Can you talk a little bit more about kind of how this has affected your strategic planning process as a health plan, and also what are some of the pivots that you've had to make?
Sure, Dave. It's interesting because we laugh and joke the same way that, if we'd have had a project plan this, it would have taken us 2 years when in reality it took us 7 days. I mean, you realize when you get into this that you just have to forego a lot of the bureaucracy that you're dealing with whenever you're trying to implement a large project. And in a lot of ways, it makes it easier because you're not deliberating over things that just you don't need to debate. For us, with regard to our strategic initiatives, what this pandemic has done is frankly, it's underscored that that we were already thinking about the right things and headed in the right direction with our priorities. It solidified our current strategy. Prior to the pandemic, I mean, we've had a strategy of growing our government programs and growing, our membership in our Medicaid and Medicare space. We've also had a strategy of increasing our digital footprint. And then we've had several provider strategies around, trying to work with the providers on more risk-sharing arrangements. And, one of the biggest strategies that we have with our provider community, as you know, Louisiana has a lot of rural health and providers that are in rural areas. And one of the things that we've seen as a result of the pandemic and the increase in telehealth and telemedicine is that the providers have benefited from being able to, have access to specialty care that, through telemedicine that they, would not have had access to. And so it's really a great thing when we can also broker that with our providers and with our big clinics and even our rural clinics, and we can help them, have greater access to specialty care and things like that. So, the great thing about all of this for us is that we believe that we are continuing to take care of our members. We're headed in the right direction strategically. And, something both Tricia and Sandy said that this pandemic has taught us as well. And that's to take care of each other and give each other grace. And, one of the biggest benefits that I've seen is everyone seems to be doing that and being calmer, being more deliberate in their approach, being more caring. We've seen some really creative ways that our leadership is working through taking care of the staff. And, you guys mentioned communication. It's so vital in making sure that in this virtual space that people are still feeling engaged and connected. That's probably the most important thing that we can do for our employees. We are looking, longer term at more, it's really more HR related issues. Some of the things that we're starting to encounter now that everybody is getting used to this virtual space and recognizing that, we can thrive. Our policies, we're a Louisiana company. We've prided ourselves on hiring Louisiana citizens. And we're now seeing that there may be opportunities to recruit talent from all over the country. We're also seeing that some of our talent is being recruited away because there's no longer the need to move physically. And some companies are, for certain roles that are in demand, a lot of companies are looking for great talent and being more open and flexible about the way the way people are working today. So, those are some of the things longer term that we're really thinking about right now. But as far as our strategy, this pandemic again has underscored that a lot of the things that we feel are important truly are, and we're continuing down the path that we were prior to the pandemic.
That's great. Thanks, Gina. Sandy, I want to come back to something that you referenced, which is open enrollment. And I always just try to think, what is on my customer's desk? And besides, what I do with them. And as Gina just referenced, HR has been hit with a lot of things, because if you look at workplace safety and the benefit decisions, all that, but now a lot around diversity and inclusion falls right on HR. Can you talk a little bit about how this open enrollment period has been different for you, because you've had to do it at a time with the pandemic? What's been different? How have you adapted, and some of the changes that have come as a result of that?
Yep, I think it's a great question, and very, very timely for those who have the calendar year enrollment cycle. So in my 8 years at Brown Brothers, I have been very deliberate in planning in terms of what we're considering for the next year. And what I'm very proud to say is we've had this, 2021, for example, we've had buttoned up since June. Now, healthcare, U.S. healthcare in particular, has been transformed at Brown Brothers during my tenure. We certainly don't have enough time to talk about what that transformation looks like, but it was, a big change, and which you might see in a firm that's been in business as long as we've been in. So I remember a meeting with our consultants. This was the last group meeting we had in March, and it was kind of a vendor meet and greet day. But we start this process in December, strategy, January, start to hone in. March was this last meeting with vendor interviews, and then things shut down. And as we started to put together our strategic plan about 2021, I thought to myself, wow, as usual, I have my foot on the accelerator, but I'm not sure that that's going to fly this year. And I had a conversation with my direct manager, who's the CHRO, who's been in the seat since it's just been since July. And I said, are we business as usual, or are we going to pull back? And from knowing me now 15 minutes, I'm not the type to pull back, but I needed to get direction. And the direction from our CFO, who HR reports into, is we are business as usual, which was delightful to hear. So what we've done for 2021, and this is interesting because the fear that I had, and it really was a fear, trying to be as sensitive to the population as possible, was putting some things on the table and going into our June meeting with our senior finance committee, when out of the gate, our managing partner, also known as a CEO in other types of organizations, dropped doubt in that conversation. And I knew exactly where he was going and what his concern was going to be. However, at the end of the meeting, we got what we needed in terms of the recommendations. We evaluated back in that March meeting expert medical opinion vendors. So we are moving forward with that change in January. We have in this environment, and this was the debate, increased deductibles and out-of-pocket maximums. We're implementing an out-of-network cost management program, which is a big deal in New York for those who have heard the term Park Avenue mentality about using out-of-network providers. We're adding hearing aid coverage, and we're also increasing employee premiums. So in a year where I thought we might be status quo, we are continuing to evolve our program, our strategy, transparency, consumerism, all in the name of sustainability, which really is tied to our values, and continuing for another 202 years.
Yeah, that's a great point, Sandy. And it was a very quick shift from a strong economy, tight labor market where everybody wants to keep benefits, like you said. Status quo, don't disrupt my employee. There's been a lot of movement there. Tricia, I'd be really interested in your perspective on this, because not only do you deal with a wide variety of clients, you deal with a lot of payers, but also you have significant payer experience as well. So can you talk a little bit about what you've seen around planning for this year's open enrollment, what's changed?
Sure. Sandy, listening to you walk through that experience, coming from the client perspective is really near and dear to my heart. And I would tell you that our experience is that there are so many folks that have had to sit there and decide, are we going to move forward with the strategy that we've been planning, or are we going to pull back? And it's really dependent on the segment of the population. So some of the municipalities that we've seen that are really concerned about how that tax-based revenue is going to change have pulled back a little bit more. Certainly, some of the professional services that had an easier time moving into more of a remote work environment have kept their foot on the gas. We've been lucky at Hub. We expected to reforecast and really change the way that our company was going to be profitable this year. And we've been able to really capitalize on those firms such as Sandy's that have really said, well, we're going to go ahead and move forward on our strategy. I think there's also a lot of other new interesting things that we can do with customers that maybe they as we were talking to Gina, really looking to transform their business. They're understanding that this might be a really great claims year because they didn't have any preventive, they didn't have any outpatient. So there might be some real opportunity to transform their strategy and move in a direction that probably would have taken them a couple of years to move to in the future. And one of those things really is open enrollment. So really excited. We've been trying to push people for a long time to understand what welcome change digital would be. Generally, benefits decisions aren't made by the person who's sitting in the open enrollment meeting. They're made by the family at least. There's definitely decisions that have to be made as a group. So being able to have that experience to play a little video at home that explains what a high deductible health plan is, or an HSA, is something we've been really trying to push our clients to move forward with for a while. Those open enrollment experiences that are either chat-based. So we've actually had some exciting times thinking about how we can transform the experience for folks, because I think far too long we've been focused on what cost savings measures are out there, and now more than ever that's still very important. But employee experience is really resonating, because I would also say we're walking that wire. You mentioned that tight labor market. I think the big challenge for us moving forward is how do you bounce from the environment where we've got deep unemployment, people are working from home, and that anticipation of knowing that quickly as we went home, we could all go back to work and now be fighting again for that talent that's really going to be important to us. So how do you maintain that really attractive benefit package that's going to attract the people that are really important to you? Gina mentioned something that really is important to me as I think about my own team. There are people out there that are looking across the country, and now that you can work from home, they will say, I'm going to look at your team and figure out how I can pull talent, not just from the city where we live. Our environment has really shifted so that I could hire somebody from Louisiana to work on my business that's out of New York. So when you think about those different environments, it's really exciting and a little daunting to think about how you have to manage your hiring strategy, moving forward with your team. One other thing I really wanted to mention was in thinking about what it feels like to work. I feel like we did a really good job in January, February, March, laying some groundwork for how we were going to execute the rest of the year. I'm most concerned now about how we get that motivation to move past where we're everybody on the panel today is getting forward, moving forward to that fourth quarter where we're focused on open enrollment, trying to get new things implemented. When we think about that push and the big relief that happens in December, January when those things are done, how do you reinvigorate a team that's in a remote environment? How do you really try and create a message around motivating what's new, what's next, in that real collaborative form to lay the groundwork that's strategic rather than just execute on the tactical things that we built off of plans that we made when we were all together in the office. So that's really my next challenge, and we're figuring out how to think about that differently now this year, because I don't anticipate that we'll be back in the office before spring of next year.
Yeah, those are all great points. A lot of this business has been paper for a long time, and still paper contracts and paper enrollment forms. I'm still convinced I have a bad shoulder from that huge HMO directory early in my career, carrying those around to open enrollment meetings. I want to pivot a little bit. This industry is a lot of regulatory change, and knowing that we're in an election year, that public policy changes always play a big factor in our industry. And so can you talk a little bit about what you see in kind of the public policy future and how that's playing into your plan? Sandy, let's start with you.
Okay, I'm gonna take a very small lane here, and really the focus is specific to ACA. We know that there's one particular party who's interested in enhancing ACA and broadening it. So we look at that, and we have another party who is focused on, I guess, blowing it up to some extent. So I think it can go in either direction. I'll stay with that. I think both parties are looking at and committed to lowering pharmacy costs, and I don't know how that will play out. But it's a short and sweet and politically correct response.
Yeah, and that's a fair statement. And I think keeping in the idea of regulatory and policy changes, you have a really, really great point in how we plan on that. Gina, from the health plan perspective, health plans play in a variety of different markets and such, even within your geography. Can you talk a little bit about kind of what you guys see in regulatory change and how you're looking kind of down the road on how things may affect your business either way?
Sure, Dave. Like Sandy said, things could go either way. And, this election obviously is going to be very interesting. COVID, has also changed the context of the healthcare debate. I mean, you have high unemployment that could increase reliance on government-sponsored healthcare. Federal budgets, state budgets, family budgets even that are under strain right now through, due to the economic and impact of this crisis. And so far, the polls that we've looked at through April, haven't really demonstrated that there's an increased appetite for structured health reform. So we're watching things very closely. I think, as Sandy said, both candidates agree on the drug regulations, and so hopefully we will see some positive things come out of regard to drug prices, which is, by the way, one of our biggest costs, especially the specialty drugs. I think we're watching other things like the surprise billing and price transparency, because again, depending on how those are defined and what is expected, it could potentially, for a health plan, it could mean a lot of work and improvements in our infrastructure and technology and things to be able to provide a lot of things. So we're just watching that. We do, either way, I think if there is a public health option, if there is increasing a government program I think from an health plan administration perspective, you know, they're going to need companies to administer these benefits. So I think that's why we feel relatively confident that, you know, no matter what the outcome, we'll be positioned to be able to support things appropriately.
That's great. Tricia, anything in particular you're talking to your clients about as they're kind of planning?
Well, I think Gina and Sandy hit on all the key points. And the one thing that I would say is our challenge is we have to figure out how to work with our clients and our partners to figure out how to price all of those options. So we have to be prepared no matter which side comes out on top in legislative reform. We have to be prepared to be able to help our clients understand what the impacts are. So we have to prepare both sides and know if there is in Colorado, it's very likely that we're going to end up with a public option. So that really changes how we'll look at small group and individual business for the year. It definitely changes how some of our retail groups or hospitality groups are going to be funding their benefits. So we have to be ahead of the game on the financial side to really help them predict the costs and set those budgets. Much like Sandy discussed, making sure that you are prepared to budget for 2021 is no small task. And it's one of the things that we at Hub really pride ourselves on, is being able to help set those budgets and make predictable guesses on the costs so that our clients can move forward. I would also say there's some changes to the way we look at the election and the transformational change that could take place. From a regulatory standpoint, we're really prepared to make sure that we're getting that information out to our clients, having a compliance perspective for all the clients, making sure that we're getting the information that they need out to them quickly. So again, looking at both sides, irrespective of which place wins, we've got to be prepared. And so there's a lot of work going into understanding what those sides could bend toward, whether that's increased ACA adoption or a pullback that's really going to change the way people look at small group benefits. We've got to be prepared for each one.
Great point. So you mentioned guesses. So I'm going to pull on that, Tricia, for our last question. I'm going to ask everybody, pull out your crystal ball and realizing, hey, that with everything and with the disruption comes change. And it's been very impressive to see how businesses have adapted so quickly. And you've mentioned, all mentioned a lot of them, from remote work to your strategic planning and looking at open enrollment. What do you see as a health plan, an employer, a broker coming out of this that you think is going to be, at least enduring, maybe permanent? And Tricia, we'll start with you.
Great. I'm sure that the way we all think of a work from home environment is going to change. We started this conversation talking about work and life integration, and I don't think that folks are going to be willing to give up the work-life integration that they've been able to build into their lives to date. So I think that there's going to be a little bit of a pullback on travel. I think it's going to impact commercial real estate. I know businesses in Colorado, a couple of big businesses in Denver, went to a touchdown space environment where you didn't really have a desk and you brought in your laptop and your keyboard every day. And I distinctly remember conversations in February where people were saying that's really never going to work. Nobody's going to want to move their desk every day and come to a remote environment. And I would tell you, now that we can fast forward several months down the line, I think that more and more of our companies are going to have to figure out how to reduce that physical footprint and allow people to work from home. Because if you don't, you're just not going to be able to attract and retain the workforce that really appreciates that environment. I think we've all sort of worked on taking the dog for a walk or taking a run and making sure that we're getting to that virtual spin class. And that's not something that I think we should take lightly. We've all been trying for a long time to get people to think about what it means to eat at home and not go out to a restaurant and have a healthier diet and maybe hit the Peloton now and then. And so we're hoping that some of those reforms really stay as people figure out how to work with that balance. Digital we've talked a little bit about digital and open enrollment. I would say having to move to that paper environment, we hope we never have to go back to the place where we're printing so much. We've been talking about going green for a decade, and now there's no other way to go because nobody's going to be there to take that physical piece of paper. So I think we're really pushing people toward that this year, and my hope is that we don't go back from there.
You raise a great point about the dogs. My dogs went in the morning when the kids went back to school. I can only imagine how bad it's going to be when my wife and I aren't here all the time. Sandy, your thoughts?
A couple of things, and I think they fall into the category of silver linings. I think that we will have a really great opportunity to dig in with respect to destigmatizing mental health. Some of the things we're looking at, which is a precursor to a mental health employee resource group that that many employers have, whether they're BRGs or ERGs or affinity groups. We are making some big commitment in the mental health space. So that's one area that we will focus on. And Tricia, I think actually everyone touched on this, and I am focused on finding a way to integrate a well-being program, which I view as its own vertical, into workforce strategy. We will be virtual for the foreseeable future, and I just don't see that integration yet, and I do think that's something we need to focus on. And it feels something like no email traffic from 9 p.m. until 6 a.m. I have absolutely no idea how to go about that, but I think that's something we need to think about if we are going to move away from the pre-COVID in the office part. The other area, which I alluded to at the outset, was our culture. And we've supported our clients fabulously. Our employees have responded so well, similar to what Gina said, 7 days for people to flip that switch. Think about all the behavior change that we have wanted personally. We can do it. Think of what we've done, 6 months ago. But I do wonder for BBH in particular what that will look like for us, given our culture, given how we collaborate in person, given the innovative conversations that we have while we're physically together. I just don't know what that's going to look like for us, but there are other opportunities that we will get deeper traction on: mental health, as I said, and figuring out that integration between workforce strategy and well-being.
It's funny you mentioned, no emails. My family went to screen-free Saturdays with the idea of getting the kids off the video games, and I think my wife and I are having a harder problem than they are. So, Gina, I'm going to give you the final word.
Okay, well, the good news about having the final word is these ladies already covered everything. So again, I think, my predictions would be along the same lines that they've already shared. I mean, I think we've got to look at, how we work in the new, how we recruit, hire, and manage resources in the new virtual world, because I do think that is here to stay. I think accelerating digital is very important. We've already seen a lot of traction with that. I think we'll continue seeing that. And I mean, even for us, Sandy talks about, mental health. The digital platforms, I think, are also supporting and promoting the acceleration of destigmatizing mental health, because they can have access to the providers. Even, you don't have to make an appointment and drive over to go see a mental health provider. You can get online and dialogue with them. So I think accelerating digital from that perspective, also, from the perspective of, just no more paper billing. We've seen a big uptick in our electronic billing because of this. So accelerating digital is here to stay, I think. And then probably for us too, one of the most important things is we all know cost is the biggest factor in all of this. You know, the cost of healthcare. It is not sustainable. So I think continued progress around creative programs, you know, moving away from fee-for-service reimbursement, getting the providers engaged in more value-based reimbursement and risk-sharing arrangements and things like that. I think the future is that as well. And I think the providers are even seeing through this pandemic, we advanced some of their value-based reimbursement, you know, to them as part of, you know, trying to bridge things along through the pandemic. So I think they're seeing the value of, you know, there's been resistance with moving away from fee-for-service, but now I think we're kind of seeing a change in mindset there as well. So those are my predictions.
Well, thank you everybody for your great comments and for your engagement. I know we want to move to live Q&A, but thank you so much. You're really showed what great leaders and forward thinkers you are in this industry. And it's really, we're fortunate to have you on this panel. So with that, we'll go to live Q&A.
Thank you, Dave, Gina, Sandy, and Tricia. This is John Emge, and I'm joined to share some questions from the audience. It's been such a great discussion, and we only have time for 1 or 2 questions, but we want to dive right in. So the first question is, Tricia, assuming that you have a forum to get customer feedback, what feedback have you received from your customers during the pandemic that has either surprised you or reaffirmed your response to the new normal?
That's a great question, and we've gotten feedback from a number of different fronts. I think I can answer that from a couple of different perspectives. First of all, we started doing a webinar series. I think when you think about what a consultant can do to help somebody set up a really robust strategy, compliance is not maybe the most the fanciest strategic imperative, but through all of this, I think compliance has become very, very important, and understanding what the new regulations are, making sure that people are complying with back to work orders, how that really changes from state to state, because a number of our clients are across multiple states, and there's so many things that are different there. So we've actually had a lot of success putting out bulletins and making sure that there is a robust support for people to understand how they can comply with what's going on. And those webinars have been enormously well received. And I think having the resources of a national consulting firm has helped a lot of our clients. So first and foremost, we've gotten a lot of really good feedback there. From something that's new and interesting, I'm lucky enough to be a part of a networking group here in Denver, Colorado. And it's clients and prospects and really leaders from across Colorado. And what's really interesting about that is we will source tidbits that are everything from strategic to tactical questions, and they'll shoot a quick question out to the group. And in my mind, that allows me to stay on the forefront of what clients and prospects are really thinking about now as it's return to work, trying to figure out how a manufacturing firm is going to stage getting people back in. Is it okay to take temperatures? You know, we've all gone through some of those iterations. So being a part of that helps me link some of the things I knew that were tried and true, like compliance, with the questions that are emerging that are really specific to what's going on with the COVID pandemic. And then finally, I would say, just from an internal perspective, linking much more often to our teams to make sure that if there's something new or different that's going on with clients, we're figuring out ways to share it with the team really quickly, so that as we're learning, we're able to iterate faster. And hopefully that is part of what we're going to learn that is never going to go away, because I think the pace of change is not going to slow down. We've now realized that with everything that's gone on with the pandemic, you know, we talked about how it would have taken us 2 years to get everybody pivoted to move from home to home. And I don't think that that is going to be, we're going to be slowing down our pace of change anytime soon. So that'd be my answer.
Great, thanks, Tricia. Well, unfortunately, that's all the time we have for questions. I really want to, first of all, thank the panelists that were just great, provided such fantastic insights. Thank everybody for being here for Health Plan Place. We hope you've enjoyed the panel as much as we have. And thank you very much. I'm going to hand it back over to John. Thank you very much for being here. Thanks for listening.
Thank you, Dave, Gina, Sandy, and Tricia. One thing that really resonated with me from that conversation is the opportunity that we have to improve based on what we're learning right now, ultimately better serving our employees or members. And while that learning is being done in real time, Benefitfocus is also proactively engaging in market research that will help us all better serve our customers, employees, and members. Earlier this year, we had the opportunity to sponsor a market analysis of the consumer digital shopping journey with Accord. Joining us today to unveil key findings from that analysis is President and CEO of Accord, Bill Perrone. This is a session you will not want to miss. But first, let's take another short break.